Today we will discuss about cardiovascular disease risk factor and its treatment. Cardiovascular disease, that is called as CVD, is the leading cause of death globally, account around about 17.2 million deaths annually. Morbidity associated with CVD is expected to increase to more than 22.2 million per year by 2030. There are three main types of risk factors associated with CVD. First type is the modifiable risk factor, including physical inactivity and poor nutrition. So these two factors belong to the lifestyle of a person, which can be modified accordingly, resulting in decrease in the intensity of other risk factors. So second types of risk factors are usually dependent upon the first type, that is the modifiable risk factors. So second type risk factors usually include dyslipidemia, inflammation and hypertension. So common risk factors for developing cardiovascular disease through progression of atherosclerosis. So some dietary interventions have been associated with the improvement in the CVD. Third type, main types in the is the metabolic syndrome. Metabolic syndrome may include three or more from these five risk factors, such as hypertriglyceridemia, decrease of good cholesterol, that is the high density lipoprotein. The second is the hypertension, the other is the hyperglycemia, and fifth one is the abdominal obesity. To combat with these different cardiometabolic multiple risk factors, a single agent with ability to provide beneficial changes in multiple risk factors is considered as ideal for patients with cardiovascular disease and metabolic syndrome. So one of such agent is a fruit called it as the Indian gooseberry or amla. Its botanical name is Umbilica esculentus, and it is also called as Phyllanthus officinalis. So it is the best choice for intervention or treating cardiovascular disease associated multiple cardiometabolic risk factors. So because the phytochemical constituent of the Indian gooseberry fruit, it includes many bioactive components. So these bioactive constituents include different types of hydrolyzable tannins, different categories of phenolic compounds, vitamin C like the ascorbic acid and the citric acid as well. The fruit is used in many types of disorders, including heart, kidney, and liver diseases. So, this fruit is a rich source of ascorbic acid with over 500 milligram per 100 gram of the dry fruit. The ascorbic acid or vitamin C, so it accounts about 50% of the anti-radical or antioxidant activity. So there are certain chemicals called as free radicals or reactive oxygen species. So these chemicals, along with higher concentration of blood glucose, may act as pathogen and damage the biomembranes of the cells of the various organs through oxidative stress. So increase in the oxidative stress damage the cells, resulting in inflammation. So in this regard, ascorbic acid very important in scavenging or decreasing the pathogenic chemicals. Experimental evidences of in vitro studies and different animal model studies indicate strong antioxidant activity of the fruit of the Indian gooseberry. So these beneficial effects have been recorded for the anti-diabetic, anti-hyperlipidemic, kidney, liver and heart protective abilities among many other therapeutic values. So studies on human population of different countries show a body of evidence that use of Indian gooseberry fruit in metabolic syndrome along with cardiovascular disease exhibit potential therapeutic effect on multiple cardiovascular risk factors as discussed earlier. So this fruit maintain blood lipid concentration, blood pressure, glycemia, inflammation and obesity. So we can take powder form of Indian gooseberry fruit orally in capsule form of 500 milligram once, twice or thrice a day according to the symptomatic condition of the patient. So this fruit has shown beneficial effect on high density lipoprotein, low density lipoprotein, triglyceridemia and high sensitive C reactive protein. It has been shown to decrease the uh, low density lipoprotein, triglyceridemia and the high sensitive C reactive protein. So this high sensitive C reactive protein is a marker of inflammation. So an important point can be added over here that by taking this simple unprocessed food with low calorie intake proved to be a significant intervention along with the use of the fruit of the Indian gooseberry. And also the patients should avoid processed high calorie diet.